So about carcinoma ovary FIGO staging. So stage 1 of carcinoma ovary is usually confined to the ovary or just to the surface. So now stage 1 is also having 1A, 1B and 1C. So now what is 1A is 1A, it's like it's confined to one ovary. It's confined to one ovary, the capsule is intact and everything, so there is no tumor on the surface, there is negative washing, everything. So it's confined to one ovary alone. If it's confined to two ovaries, then this will be 1B. So again same, both the ovaries has tumor, but it is confined to the ovary, it is having intact capsule, no tumor on the surface or anything else. So that is 1B. Now what is 1C is tumor on the surface of the ovary. So something which suggests that the capsule is not intact anymore, everything else is negative, only the suggestions that the capsule is not intact anymore is 1C. Okay. Now see, it can also be because like just before you take up the patient for the surgery, just before that the capsule might have ruptured, or due to the surgery itself they would have nicked the capsule. So either the spill has happened due to that, or you can visualize that there is tumor on the surface, everything else is negative. So that is all 1C. So 1C also has 1C, 1, 2 and 3. 1 is due to surgical spill, 2 is just before the surgery that has happened, or you can see the tumor on the surface. 3 is like when they take the peritoneum washing, when they take the ascitic fluid, when they find the ascitic fluid, when they take the peritoneal washing, then those will be having positive for cytology. So that is stage 1. 1A, 1B, 1C. This is kind of important because ovary is such an organ that just when the capsule ruptures, it like spreads everywhere. So that's why treatment is also very aggressive. It is like the cytoreductive surgery for them, or debulking surgery. So yeah, that was about stage 1. Now what is 2? 2 is either extension to the fallopian tube or extension to the uterus. So uterus or fallopian tube will be 2A. Now what is 2B is like 2B is like it's within the intraperitoneal tissue. So there is spread beyond uterus and fallopian tube, but it is within this is the peritoneum, so it is like within the pelvic peritoneal tissue. So that is 2B. Okay. Now 3 staging, coming to stage 3 is so this is all within the pelvis and within the peritoneum, right? So now if anything goes beyond the peritoneum or beyond the pelvis will be stage 3. Stage 3 is again now divided into A, B and C. Now I'll be telling like most of this is like beyond the pelvis, it is going to the abdomen, so it is beyond the pelvis. Now A is again divided into 1 and 2. 3A1 is extension to the retroperitoneal lymph nodes. So these are all peritoneum, right? So it is go to retroperitoneal lymph nodes. That will be stage 3A1. So that will be 3A1. Now what is 3A2, B and 3? This is all, it's all based on extension to the extra pelvic tissues. Now 3A2, B and C. 3A2 is like it has gone extra pelvic, but it is microscopic. So this is microscopic. Okay. Now stage 3B and 3C is like this is also extra pelvic, this is pelvic, so this is also extra pelvic extension. So beyond pelvis, what we have abdomen, we have liver, spleen and bowel, everything. So this is all extra pelvic, but it's in the abdomen, but it has this microscopic spreads, whatever I'm talking about, it's just the peritoneum which is covering the abdomen. So the capsule of the liver, the spleen covering, or the peritoneal, anything which is like where the peritoneum has covered, and it is extra pelvic extension, that will be stage 3B. This is macroscopic. Now difference between stage 3B and 3C is like it is similar, just based on size. Macroscopic 3B will be less than 2 centimeter and 3C will be more than 2 centimeter. So any lesion which you find on the splenic surface or the liver surface or the bowel surface which is having peritoneum, so if these lesions are less than 2 centimeters, then you will call it as 3B. If they are more than 2 centimeters, then you will call it as 3C. So now this was about extra pelvic extension about the ovarian tumor. Now what is 4A and 4B? 4A is like what do we have beyond the abdomen? Beyond the abdomen we have thorax. Thorax mein we have like lung, and there is a peritoneal, like pleural cavity. So if you find there is a pleural effusion and you take that effusion for cytology, and if that cytology is positive for malignancy from the ovary, then this is 4A. Okay. Now 4B is any extra extra abdominal. So this is abdomen, right? Anything extra abdomen, so matlab thorax, that is the next is thorax, right? So any extra abdomen organ which is involved, or the parenchyma of the liver and spleen. So I said like only the covering has to be involved for 3A, 3B and 3C. So if the parenchyma here is involved, then it is 4A, 4B. Even if inguinal lymph nodes are involved, obviously this is beyond pelvis, right? If the inguinal lymph nodes are also involved, then also it is 4B.